The most dangerous thing about your prostate isn't actually cancer. It's the things men trust completely, even though they're wrong at the root. You can get your checkups, take every virility enhancing supplement on the shelf, and avoid all the bad foods. But if you believe just one of the common myths circulating today, you are walking straight into a silent trap. The condition keeps progressing while you feel falsely reassured. And here's the scariest part: your prostate usually doesn't scream for attention. It doesn't hurt to warn you, it just changes little by little, day by day. Until one morning, you're shocked by frequent nighttime urination, a noticeably weaker stream, the frustrating feeling that you never fully emptied your bladder, or worse, finding out too late, when the damage is much harder to reverse. If you're over 40 or you have a father, an uncle, or a brother struggling with these issues, treat this video as a critical warning sign before a major crossroads. Today, as a urologist, I'm peeling back the layers of the most common prostate myths that cost men their health and their quality of life. Stay with me until the end and honestly check how many of these you've believed yourself. If this clarity helps lower your anxiety, subscribe to join our community. And to help me tailor my next videos to your needs, leave a simple number in the comments, type 1 if this was helpful, or 0 if you need me to cover something else. Now, let's start with the first myth, a single sentence that sounds obviously true but has kept millions of men dangerously complacent for years. Have you noticed something about how we handle health? Most men won't step foot in a doctor's office until the pain is so sharp they can't ignore it anymore. We're programmed to tough it out. But here's the reality: the prostate plays a silent game. It doesn't scream, it whispers. It changes slowly, just enough to make you wake up once or twice a night or cause a slight hesitation in your stream. And what do? We rationalize it. We tell ourselves, it's just part of getting older, or I just had too much coffee today. The danger is that your body doesn't always use pain as a signal. Some conditions progress in total silence, and by the time you actually feel hurt, you're already miles behind the starting line. You're waiting for a loud fire alarm, when what you should be listening for are the tiny clicks in the middle of the night. So ask yourself the hard question: are you waiting for agony just so you can feel justified in seeing a doctor? Or do you want to catch the problem while you're still the one in control? Because if you only rely on feeling sick, you'll always be one step behind. And in urology, being one step behind can cost you years of vitality and quality of life. Now, for the men who do notice these signs, the mind immediately jumps to the worst-case scenario. You start waking up at night, your stream weakens, and you think, this is it must be cancer. Take a deep breath. This brings us to myth number 2, the misconception that makes men panic in the wrong direction while staying dangerously complacent in the other. Frequent nighttime urination, urgency, a weak stream, and that annoying hesitancy. It sounds terrifying, doesn't it? When a man experiences these, his mind almost always jumps to one word: cancer. But here's the ironic truth: most of these frustrating urinary symptoms are actually linked to BPH, benign prostatic hyperplasia, which is a non-cancerous enlargement. You're lying awake at night worrying, but you're likely worrying about the wrong thing. To understand why, you have to look at the anatomy. Prostate cancer typically develops in the outer part of the gland. Because it's on the periphery, it can grow for a long time without pressing on anything, meaning it often has no symptoms at all in the early stages. BPH, on the other hand, grows in the central zone, right where the prostate wraps around your urethra. As it grows, it squeezes that tube like a kink in a garden hose. That's why you feel it immediately: the weak stream, the I still need to go feeling, and the constant trips to the bathroom. So the real question isn't just, do I have symptoms? It's, what are these symptoms actually pointing to, and what is my next move? If you panic, you'll end up chasing miracle cures online or taking random supplements that do nothing but drain your wallet. But if you dismiss it as just aging, you miss the golden window to manage the condition before it affects your kidney health or sexual function. And speaking of taking action, many men cling to one magic number to tell them they're safe. They say, my PSA is under 4, so I'm fine. Actually, that might be the most dangerous trap of all. Have you ever heard someone say, "My PSA is only 3.8, so I'm fine"? It sounds like a free pass, right? But here's the professional truth. PSA isn't a simple green light, red light test. It's more like a smoke alarm, sensitive, noisy, and sometimes triggered by things that aren't a fire. Most importantly, there is no single, absolutely normal number that guarantees you are 100% safe. Some men have a PSA that stays low, while a high-risk condition develops quietly. Other men have a spiked PSA due to inflammation, a recent bike ride, or even just an enlarged prostate that has nothing to do with cancer. If you cling to one number and breathe a sigh of relief, you're turning a medical test into a dangerous lullaby. So what should you do instead? You must treat the PSA as a starting point, not the finish line. It's a marker that should trigger the next set of questions. What risk group am I in? What is my PSA trend over time? This is why we use what I call magnifying glasses. As a urologist, I don't just look at one number, I look at the free PSA ratio, the PHI, prostate health index, or order a prostate MRI. These tools allow us to see through the noise of the PSA and decide whether a biopsy is actually necessary or if we can just monitor you safely. The key is simple: don't diagnose yourself based on a single laboratory value. But right about here, I see it in my patient's eyes. A chill goes down their spine as one question comes up: what if you recommend a biopsy? This is exactly where fear makes men delay, skip appointments, and sometimes pay the ultimate price. Just hearing the word biopsy makes many men imagine something brutal: severe pain, high risk, and terrifying complications. And then comes that familiar comforting line we tell ourselves: let's just take it slow, it's probably nothing. I'll just monitor it for another year. But as a doctor, I have to tell you the hard truth that taking it slow is exactly how men lose their golden window. Modern medicine has changed. Today, a prostate biopsy is typically an outpatient procedure done with local numbing or light sedation. It's not something we do casually or just for fun. We recommend it only when the benefit of an early diagnosis far outweighs the risks of the procedure itself. Image: comparison of early detection versus late-stage treatment outcomes. A biopsy isn't about looking for trouble. It's about confirming the truth when the risk signals become too strong to ignore. So here's the question you need to ask yourself honestly. Are you afraid of the procedure because of the risks, or are you afraid of facing what the results might say? There are fears that protect you, like the fear of walking into traffic. But there are also fears that paralyze you, making you miss the one real chance to catch a problem while it's still easy to manage. And that leads us to one of the most stubborn myths men hold on to, a myth that causes unnecessary stress and leads to the wrong treatments. If I have BPH, it will eventually turn into cancer. If you believe this, you are worrying about the wrong process entirely. A lot of men hear the words benign prostatic enlargement and immediately start living with a shadow over their heads. They think it's only a matter of time before this turns into cancer. But that belief keeps you living in fear for years, and it doesn't actually protect your health. Let me clear this up once and for all. BPH is not a precancer condition. It is a common, age-related benign overgrowth. It doesn't transform into cancer. However, here's the tricky part that many people miss. BPH and prostate cancer can exist at the same time. BPH doesn't cause cancer, but having BPH doesn't mean you're immune to it either. So what mindset should you keep? Don't panic, don't assume, and please do not self-treat based on hearsay or random internet supplements. What you need is a professional evaluation and a consistent follow-up plan to manage your symptoms and protect your quality of life. Because at the end of the day, the goal isn't to live in fear, it's to live in control. Slow down the pace, lower the tone for the final warning. Now, before you go and think, okay, I've got this, I need to leave you with a very direct warning. There is one specific mistake, one subtle oversight, that makes men miss their earliest chance to save their health. Most men only realize they've made this mistake when it's already too late to turn back. I'm going to reveal exactly what that mistake is and how you can avoid it in my very next video. If this was helpful, leave a 1 in the comments or a 0 if you have more questions. I'm Dr. Emily Carter, and I'll see you in the next one to make sure you stay ahead of the game. You can forget everything I've said up to this point, but please don't forget this. Your prostate doesn't always sound the alarm with symptoms, and prostate cancer, it's even less likely to. If you wait for your body to speak up before you act, you aren't just being cautious, you're choosing late detection. Here's a chilling question I want you to sit with. If one day a doctor looks you in the eye and says, "If only you had checked earlier, what would you say?" Would you say, "I didn't know"? Or would you have to admit, "I was warned, but I delayed"? Don't let that be your story. In my next video, I'm going to lay out a simple, clear roadmap that every man over 40 can follow. It's a plan that keeps you from spiraling into unnecessary anxiety, but ensures you never miss what matters most. Because you'll see this clearly. Taking care of your prostate isn't about living in fear, it's about learning how to be proactive, the right way. I'm Dr. Emily Carter. Your health is in your hands. I'll see you in the next video. If you've watched up to this point, I want you to take away something clearer than any scare tactic. Prostate health isn't a game of wait for symptoms and then deal with it. It's about small, consistent, and correct proactive habits. The real value here isn't in memorizing every medical term. It's in doing something deeply manly in the best sense of the word. Sitting down, looking your body's reality in the eye, and making a plan for routine checkups instead of gambling on luck. If you're over 40 or if you've started waking up to pee at night, noticing a weaker stream, or feeling like you never fully empty, don't self-diagnose, and please don't self-treat based on word of mouth. Treat it as a reminder to talk to a professional, get the right tests, and follow up intelligently. Doing that won't make you more anxious. It frees you from anxiety. If this video helped you understand things more clearly, drop a 1 in the comments as a simple commitment. I'm going to be proactive. And if you want me to clarify anything, drop a 0 along with your question. I read them all, and I'm here to help. And remember, that famous saying is still true when it comes to your health. The best time to plant a tree was 20 years ago. The second best time is right now. I'm Dr. Emily Carter. Take charge of your health today. I'll see you in the next one.